NHA Phlebotomy Exam. Let's get started. When performing a capillary puncture on an infant, which site is preferred? Is it A, the central plantar surface of the heel? Or B, the earlobe? Could it be C, the lateral or medial plantar surface of the heel? Or lastly, D, the fingertip? The correct answer is C. Here is why. Puncturing the lateral or medial plantar surfaces of the heel avoids the calcaneus, heel bone, reducing the risk of osteomyelitis and targets a rich capillary network. A. The central plantar surface is dangerous due to the proximity of the calcaneus and important nerves. B. The earlobe is not a standard site for infant capillary collection. D. Fingertips are not used on infants due to small size and increased nerve density. They are reserved for older children and adults. Next question. What is the purpose of gently inverting tubes after collection? Is it A, to prevent hemolysis? Or B, to mix the additive thoroughly with the blood? Could it be C, to speed up clotting in serum tubes? Or lastly D, to separate cells from plasma? The correct answer is B. Here is why. Gentle inversion, typically 3 to 10 times depending on the tube, ensures the anticoagulant or preservative is evenly distributed throughout the blood to prevent microclots or sample degradation. A. Rough inversion or shaking can cause hemolysis. C. Serum tubes, like SSTs, are inverted 5 times after collection, but are then left undisturbed to clot. Inversion doesn't speed clotting. D. Separation of cells from plasma/serum is achieved by centrifugation, not inversion. Next question. If a patient has a mastectomy on the right side, from which arm should blood be drawn? Is it A, the right arm only? Or B, the left arm, to avoid risk of lymphedema or infection? Could it be C, either arm is acceptable? Or lastly D, from a foot vein with physician permission? The correct answer is B. Here is why. Blood should not be drawn from the arm on the same side as a mastectomy due to the removal of lymph nodes, which significantly increases the risk of lymphedema and infection. A. Using the affected arm is contraindicated. C. The arms are not equivalent in this scenario. D. Drawing from a foot vein is an absolute last resort requiring specific physician authorization due to higher risks, e.g., thrombosis infection. Next question. Which of the following is a complication of venipuncture characterized by a large, raised bruise? Is it A, petechiae? Or B, hematoma? Could it be C, syncope? Or lastly D, phlebitis? The correct answer is B. Here is why. A hematoma is a localized collection of blood outside the vessels, causing swelling, discoloration, and tenderness, often due to needle through puncture or inadequate pressure. A. Petechiae are tiny, pinpoint hemorrhages, not a large bruise. C. Syncope is fainting. D. Phlebitis is inflammation of the vein. Next question. What is the maximum recommended time a tourniquet should be left on a patient's arm? Is it A, 5 minutes? Or B, 3 minutes? Could it be C, 2 minutes? Or lastly D, 1 minute? The correct answer is D. Here is why. 1 minute is the standard maximum to prevent hemoconcentration, which can falsely elevate protein-based, lipid, and ion, like potassium, concentrations. A, B, C. Longer application times lead to stasis and alter test results, compromising sample integrity. Next question. For a blood alcohol test, which tube is typically collected? Is it A, lavender top EDTA tube? Or B, gray top sodium fluoride tube? Could it be C, red top serum tube? Or lastly D, green top heparin tube? The correct answer is B. Here is why. The gray top tube contains sodium fluoride, a glycolytic inhibitor, and potassium oxalate, an anticoagulant, which preserves blood alcohol concentration by preventing metabolism and clotting. A. Lavender top EDTA does not effectively inhibit glycolysis, allowing alcohol levels to potentially decrease. C. Red top tubes allow clotting and glycolysis, which can affect alcohol stability. D. Green top heparin tubes do not contain a potent glycolytic inhibitor. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.